Us. My name is Bridget Massengill. I'm President and CEO of Thrive Regional Partnership. It is our honor and privilege to have all of you here with us today. I am just going to do some top of the house things, and if you will see on your slide, we would like to ask everyone to mute their sound, and you can find that if you haven't yet really played around in Zoom. You can see that down on the bottom left-hand side of your screen. There's an unmute and a mute option. So we'd like to ask everyone to mute, and then also there's a chat feature. You'll see the little chat icon also along that row across the bottom. We are going to be really active in that today, and we're requesting that everyone submit your questions and comments throughout the presentation in that chat box. We will be hearing from our presenters today, and at the conclusion, we will be opening up for those questions, and the Thrive staff will be compiling those so that we can make sure your question is addressed before we get off of this meeting today. So with that, I am going to turn it over to the chairman of our Thrive Regional Partnership Board, Connie Vaughan. She is with McKee Foods, but has served as our chairman for 3 years now. And I am grateful that you're here today, and she is going to lead us through what we're about to talk about today and the participants. So Connie, I'm going to turn the virtual platform over to you now. Oh, we can't hear you, Connie.
Hear me. Okay, how about now?
Yes.
Very good. All right. Thank you all so much for joining us. And we know that lots of activity happening all around our region, and we hope that you all are well and your family is well, and that we've been fortunate that our region is not experiencing the COVID-19 like those in New York and New Jersey and others. So, but yet still we're experiencing quite a bit of loss, and certainly when we think about the economic impact to our region, it's just going to be critical. So you know that Thrive has been in place just to serve this region and to really think about and help individuals in the communities, those community leaders, think about responsible growth through conversation, connection, and collaboration. And so Thrive has continued to do that. The Thrive staff has just not missed a beat, working very diligently, working from home. Early on, had some illnesses in the staff, but fortunately, no COVID-19 confirmation, but just critically really felt sick for several days. And so Bridget took swift action early on dealing with that in the office. And so they've been working from home, but I'll tell you, they have not missed a beat. And this regional support guide is a terrific example of the work that they put together from working from their homes and staying active and in touch with our community. So this came about because one of our community leaders in one of our rural communities called just desperate for help. What do we do? Our businesses are closing. How do we help our region, and what resources are available, and how do we get our local elected officials in touch with the resources? And so the Thrive staff just went into action and put together this regional support guide. So Shannon has done a lot of the research and put all of that together. Certainly Rhett and her creative communication skills have come into play, and Kelly with her connections to the communities. Of course, Bridget's leadership. So this product came about because of a request from one of you. And so it is intended to be helpful. It is intended to be just what it says. It's a regional support guide. So we want you to look to the Thrive staff as help. You're going to hear today from Justin and Kelly. We'll introduce them in a minute, and they can help further the resources available to you and help you know those. So Shannon, let me turn it back to you, and you just talk a little bit about the support guide, and we want to make sure that folks get access to all of that. So I'll turn it back to you, Shannon, and then I'll introduce Justin.
Great. Good morning, everybody. This is something that you should have in your inbox. If you've signed up for the webinar, then I feel like you've probably seen this, or it's at least hit your inbox once or twice. As Connie said, this was born out of a frantic call over a weekend, and we took that, Bridget, Rhett, and I sat and thought, okay, how do we take this and make it for more than just one community? How do we blow that up and really make this a regional resource? So this is the product. I'm just gonna step through some of it, and then if you have any questions, please let me know. But when you're logging in from home or looking at the support guide, here we go, this is what you're gonna see. This is a document that we created. We set it up in a way that you can log in and look at this without actually having to log into Google. So you should be able to navigate it pretty easily from wherever you are. And it's designed to be a living and breathing document. There are so many groups and organizations out there who are gathering information. As you all know, things are changing daily. As soon as you say something, essentially it could be dated. But what I really wanted to do was just make this a place that folks could go to know that we would be linking them to the proper, credible information. So when you look through this guide, there's a slide here that's gonna explain what it is, and then also sort of tell you how to navigate it for those folks, either y'all in your office or someone you're sharing this with may not be familiar with Google Slides. So this is the idea behind that, is just simply how to navigate it. And then, like I said, this is a living, breathing document. So we really want communities, you guys, to look through this. And if you see something that needs to be updated, if you see something that you'd like to, or you have something you'd like to add, you can do it inside this document simply by leaving a comment, and then we'll get it updated. I update this at least once a day, usually more than that. Slide 6 here is going to be your navigation tool. These all link to the slides that correspond with this information. So what I've tried to do is compile links to federal organizations, regional resources, and then breakdowns by state and county. A lot of counties are doing a good job of updating a lot on Facebook, and then other websites. So I've put those in specific slides. So please, if you know of some other resources you'd like to see represented in there, please let me know. This is the regional response dashboard that was built by our partners at the IGT Lab. They've done some amazing work through this over the last few weeks. This dashboard, if you haven't seen it, is a real-time update. The image you see here is timestamped, so I'll always update that timestamp as I'm updating this. The last time was this morning. But if you actually go to the dashboard, again, all the links in here are clickable. This is what you're gonna see. This is aggregating data from a variety of sources. I would encourage you to get in here and dig around. Anytime you see a little arrow like this, you can blow up that one part of the dashboard to get a good look. So please play around in that, use it. I look at it every day anyway. It's a good resource that's also linked in here for you as a quick place to go. New resources, this is relatively recent, but again, things are changing every day. So as there are new resources that are of particular interest, I'm going to drop them up here at the top. For instance, CDC just put out their new guidelines yesterday for when and how essential employees can return after they've been exposed to COVID-19. So that is up here. The webinar that we did on Tuesday, what's today? Blur's Day? Thursday? The webinar we did on Tuesday is here for artists and supporting communities. So that's going to be a recurring sort of updated slide all the time. what I'll do is pull these resources down into the appropriate slide after. There is a community assistance survey. Much like what started this idea, we realize there may be some communities out there, some of your communities, who don't necessarily have the capacity to be able to get a needs assessment or a community assistance survey out into their communities quickly. So we created one that we can help parse data for you if that's something that you're interested in. My contact information is here on the slide, and then the link to share the survey with your community members. Please feel free to do that. I'm parsing that through zip code. So if you're interested in any of the data that's coming specifically from your community, if any's been received, then I'm happy to send that specific information to you. More IGT planning documents. If you haven't seen these, Rhett, I believe you sent these out within the first week, really, of all of this snowballing, right? It feels like. So these are community impact reports. These do not change. This, Rhett, correct me if I'm wrong, but this is data from Johns Hopkins. Okay. And again, the IGT lab pulled this data. These are specific to your county. So you can dig into any county that you'd like. Let's go with Ray County, for instance, now. This is Ray County's impact planning report. Again, this doesn't change. What this is meant to do is give you a snapshot of how many households there are, which populations considered vulnerable are in your community, how many hospital resources, things like that. So dig into these, and if you have any questions, you can reach out to Rhett, or we can get you in touch with the folks over at the IGT lab to help further explain some of this data. Charlie and his team have made it clear that they're here and have sort of flung their doors open to help in this situation. So if you're interested in some of that, please let us know. Also in this, you're going to find the CDC Social Vulnerability Index. Play around in that. You can dig specifically into some county data there if you're interested. Much the same. Dig through this information, see what's there. A lot of it's going to link you back to the IGT Lab GeoHub work that we've been working on for food needs, internet access, and Wi-Fi locations. Joe, I know you emailed me yesterday about a couple of Wi-Fi locations. Those are on the map, which is exciting. So that is a regional resource. You can dig straight in and see address level data about Wi-Fi that's available. Here's where we get into federal, regional, state needs. Again, I am not better than the CDC. I'm not the expert. None of us are. So what I'm doing is making sure that you guys have the links you need to those places. So when it's overwhelming, you can't think, okay, have I seen that information? Have I looked at the FDA's announcements on this? You can go to a one-stop shop and know that I'm going to link you to those places. And a lot of these are top level because they're changing again so often. Again, webinars that may be of interest. This CDC call for rural partners a couple weeks ago was really fascinating. I'm hoping they'll do another one of those soon, and I'll get that updated. These regional resources. In the beginning of this, for any of you who have been using the document, you may have noticed I was updating these videos every day. With everything else going on, that got a little heavy. So instead, now these are images, but when you click on them, it's going to link you to the Alabama Public Health Department's YouTube page, or whatever that is, the Chamber's YouTube page for their webinars. Again, this is top level. I'm getting you to the site, and then you can find the information that you need. Local level as well. Dade County is doing a great job. Catoosa has their own business survey out. Walker County is updating via Facebook. So is the Dalton Chamber. So this is what you're going to see in the guide here. And then for those who know they have some specific wants, small business owners, information specific to finance and insurance, or legislative and legal, manufacturing and freight. I have some of those sections in there. So with that, I'd really love just to open it up to see if you guys have any specific questions about this. Otherwise, we'll dedicate most of the time to Justin and Kelly, since I know that's what you're probably here for. So any questions from anybody or anything like that? Sorry, I'm trying to pull up my chat box. Anything coming through? Okay. Well, I will just say again, please look through this. If there's something that's not there that should be, please let me know. And I'll turn it back over to Connie.
Shannon, I mean, just amazing work, truly amazing. And for those of you on the call, I hope you find the resource helpful, and I certainly think that you could hear Shannon's passion about being a resource for our communities. So that's what Thrive's all about, and that's the work they're doing every day. I want to introduce to you Justin Groenert from the Chattanooga Chamber of Commerce. And Justin is new to our region, but you will see he has jumped right in, and we welcome him to the board for Thrive Regional Partnership. He's Vice President of Public Policy for the Chattanooga Area Chamber. And Justin is new to this region, but it's just been fascinating to watch him jump in, volunteer. How can I be a resource? How can I use my past experiences and my current platform to be helpful? And that's so needed for us. We need the resources of Hamilton County and Chattanooga to continue to do our work. And so, Justin, we appreciate you taking the time and being here. We appreciate you being a partner for Thrive and for our region. So take it away, Justin. Thank you for being here.
Well, it's just great to be with you all, and thank you for the kind words, Connie. I'm happy to be a Chattanoogan now, and it's been about 9 months, and it's been an eventful 9 months for certain. But I'm happy to sort of talk about whatever the group kind of wants to talk about. We've got a lot to go through in terms of the fast-moving public policy space. So I'll certainly kick it back to Connie to introduce Kelly, and we can have a conversation.
Connie, are you with us?
I am with you.
Hey. Okay, good. Sorry, I thought I wasn't sure what was happening. I thought we might have lost.
But is Justin there?
Yeah, I'm still here. Can you? Okay, everything just sort of froze up on me. Sorry.
That's okay. Justin introduced. So if we want to introduce Kelly, and then we'll open the floor for some discussion.
Okay, sorry about that. I had to go get a jacket. I'm sitting outside, and it was like, poof, frozen. Sorry about that. So Kelly is with Senator Marsha Blackburn, and you will certainly see that Kelly has a heart for this region, and so she can be a terrific resource to you with all the things happening at the federal level. And she's been attending Thrive meetings. We're just so thrilled to have her partner with us and have her expertise. So thank you, Kelly. Take it away.
Hey, can you all hear me okay? Okay, good. We're just honored to be here on this call today. I know this is a trying time, for everyone right now. Everyone is anxious. I just want to say so many praises for Thrive, everything that you all have pulled together. Shannon, this is amazing. You all always are so impressive with the amount of information that you supply for our region, and so we just greatly appreciate that. And again, I am happy to, just as Justin said, try to answer any questions as best I can. There's several things that we can go through, so I guess just depending on what the discussion is and the types of questions, I'm happy to chime in anywhere I need to. So I don't know, should I just back to Connie?
This is Rhett. I'd like to jump in with a question just to kick us all off, if that's all right. We're seeing a lot of, and I'm sure some of our regional partners, up in Ray County and other places can speak to this as well. Could y'all speak to any conversations or updates about support for broadband initiatives across our counties and states? I know that that's, becoming a huge sort of issue in a lot of different ways here, just from remote work to public education, telehealth. What are all the different ways in which policymakers are having conversations around that topic right now?
I would say, obviously, this has been one of those conversations that has been sort of ongoing forever. And, in Chattanooga, obviously, with EPB, it's sort of a different conversation than a lot of more rural counties are having. I would say a lot of policymakers, obviously, are looking at a lot of things right now, and a lot of it is sort of the immediate health crisis. I would be shocked, though, when we come on the back end of this, if that doesn't move up the list rather quickly in terms of a very high priority. I think we've all seen that our economies obviously have slowed down quite a bit due to actions that none of us really had anything to do with. But I think it's also shown that there's been a real adaptation for a lot of organizations who have been forced to work from home, change how they operate in a lot of ways. And I think that, I think we all see the importance of the connectivity that broadband and internet access provides us all, especially now. And I think it's probably as important or more important. So I would look for that to become a much higher priority, both in future federal legislative packages, and I would certainly assume at the state level as well.
I'll agree that.
And I would just,
Go ahead.
sorry, can you all hear me? I would just echo that too. I know in the CARES Act, the first portion of the money that was released, there is a small portion that was for broadband assistance. I know there have been several folks that we've heard asking about the next packages that are ahead. Will there be infrastructure funding in those packages? And I know that is being discussed. I know broadband is also being heavily discussed in that. Senator Blackburn certainly is a huge champion for broadband. She wants every community, every county to have access, especially right now with telehealth. Those are options that we certainly want to see every American be able to have an opportunity to use telehealth services, especially during times like this. But also just being able to be connected. Some of our counties don't have access to internet at all. I mean, some of our schools being closed right now. The children are having to go to a hot spot that's located in the area. So there are several disadvantages that some of our counties have, and we really want to do what we can to push to have everybody connected. So there are ongoing discussions about continuing federal funding for broadband.
Mm. And I mean, you can see it too with EPB putting up their, 27 hotspots around Chattanooga and the region. It's a real need for sure, and I think it again will only increase in importance going forward.
Yes.
John, I think you had a question or.
Oh, I was just going to comment that, right now, it seems to me that more on the community leadership side that right now they're scrambling for health issues, but obviously this is something that's related and interconnected. And that once we kind of get a bit more handle on some of the health issues, then I think this will come more to the forefront, at least for us. But very serendipitously, there's a local provider that was in process of finishing some things, and they were able to really come through for us in one of our key local, very most underserved areas. And it just kind of, the timing worked out perfectly where they were able to really come through on a hot spot in a very underserved area right about the time that this crisis happened. So we've gotten lucky on a few things, and I hope that we can be more than lucky. We can plan for some things, and that this will bring some of these issues more to light. So I appreciate you guys and all you're doing, and I think there was a nice email string that Rhett had started, and we were really bringing up that conversation. And I think my next hope is to try and get some of our state legislators involved as well.
Awesome, John. Thanks for that update. Keep me posted.
If no one else has a question, I'll just jump in real quickly. Justin and/or Kelly, there's been some discussion, and Kelly, you may mention it just now, about another congressional action or package that would have an infrastructure sort of focus. Can you speak to how or what any discussions you guys are aware of, how that might affect the transportation, freight, and logistics side of things of infrastructure rather than just broadband?
I mean, just sort of following it along. I mean, I'm sure Kelly's got some more insider info, but it appears the way the federal government sort of attacking this is the first package was an initial $8 billion to get tests cranked up and try to get caught up from basically getting caught flat-footed from the pandemic. Phase two, the House passed and sent to the Senate, was more focused on sick leave, paid family leave, what to do when you're sort of displaced from work, and how organizations can handle that. The third package obviously was sort of an economic sustaining package right now. You can't really call it a stimulus at this point, because at this point it's the federal government floating us all, funds, flooding the market to keep our heads above water as we've kind of had to shut the economy down. Phase four, and I'm going to guess we're going to go probably phase 5 and phase 6 by the time this is all said and done. I think will certainly have more of a stimulating effect, getting people back to work. Transportation is obviously one of the keys to a phase 4 or phase 5 package that has been sort of talked about. I would say that logistics and actually pavement, concrete roads going in, surface transportation will obviously be a key to that. It drives a lot of jobs. It drives a lot of economic activity to ancillary companies in a region. As to whether it's in a phase 5 or phase 6 package or phase 4, I think remains to be seen. I think everyone's still trying to get a grasp of the sort of the economic damage that's sort of being done by having paused everything. One of the things they're already sort of trying to do ahead of a phase 4 package is add another $251 billion to the Paycheck Protection Program. That would get that up to about $600 billion for small businesses from 500 or less, and 501c3 entities, sole proprietors, contractors can have sort of an 8-week fund to help keep employees on the payroll. So you're going to see a lot more of that, I think, first. And the other problem you have too is Congress isn't in Washington, and there's a lot of concerns from the medical community of getting them all back. We saw at the end of the phase 3 Senate discussions and votes that one of the senators came down with COVID-19, which put a lot of people sort of at risk for catching it that are quite important to how our government functions. So there's a lot of slow walking when they may be able to come back. So they're going to try to do some things through unanimous consent and voice votes to maybe push that extra $251 billion quickly. But yeah, I would say transportation would be a key, as it is in most sort of federal stimulus packages, because it's a good way to build out pieces of the economy and improve sort of quality of life for everyone. What would you add, Kelly?
I think that's exactly right, Justin. Like I said, things are very fluid right now, and changing, sometimes by the hour, certainly changing daily. So I do think there is a lot of discussion right now on phase 4 and how some of that should be structured. But I agree that exactly what you're saying. Everything that we have been focusing on in these first few phases has certainly been about the economy, stabilization, and trying to help our constituents and citizens with just everyday life, just being able to continue to manage moving forward, taking care of their households, being able to pay their bills. So I do know that transportation will be a huge part of that. How that will roll out, we're not sure yet, just because it's so fluid, but I do think that we will see a lot of assistance coming down the road.
I know we have.
I was going to say, is Dan Palme on?
Yeah.
Dan, would you like to comment maybe
Sure.
specifically around Tennessee and conversations as this has certainly impacted state budgets and that sort of thing? Talk a little bit about what your perspective is
Sure.
at the state level.
You bet, Connie. So I guess at the state level, the way this rapid, how this hit everybody, and it hit everybody from private to public, and obviously fortunately we were able to, with very little impact, to really work remotely. So the best news for the state of Tennessee, I think, from that perspective, was that we're still moving forward. We're still getting out there, fixing potholes, doing road construction. It really hasn't impacted, other than about the only thing that I can say is like contracts. It seems like we do a lot of contracts and have to have T's crossed, I's dotted. And I think that's one thing that still goes into the office that we have to do. But I'll give you a little different perspective. I think there's no doubt what this is going to do to our budget for the next fiscal year. It's business as usual now, and I would almost offer to say it's a great time for us to get out there and really do some of these repairs with less vehicle traffic. So it's a lot safer right now to do it. Chief Engineer Paul Deggs actually reached out to all the regions, and this is a unique perspective to sit there and say, where historically maybe we'll do that state route in a rural area, do that construction at night. Well, now maybe we can do that during the daytime, which A, is a lot safer, but B, would help some of these rural communities better than ever because of schools and things of that nature. Since they're not in session, that is a double whammy of people aren't on the road. So we can do some of this road construction faster, quicker, more convenient, and for the taxpayers of Tennessee is what they really want to do. So that's a little bit different perspective of a positive on COVID-19. Obviously, we're watching the numbers every day to make sure people are staying at home and the effects that it has on us. But then the flip side is it's going to negatively impact our budget for years. But it is what it is, and I think for the taxpayers, we're doing a great job in the state of Tennessee. So a little different perspective there.
Shannon, Rhett, you have other questions?
Yeah, I think, Joe, you have your Zoom hand raised.
Yeah. I had a quick question for Kelly. Kelly, has there been any discussion at the federal level as far as addressing the HIPAA law, and especially how it pertains to sharing information with first responders who may be responding to someone who has tested positive, but yet that information is not being shared with them?
I do know that we have had some conversations about HIPAA. Some of those conversations we have had with some of our federal agencies where people have actually been tested positive for COVID, and they're coming in contact with people in the public. Mm-hmm. So I do know we have had some conversations about that, and I think that will continue on. I'm certainly happy to pass along any comments or concerns that you may have on this to get further information for you. But we have seen that happen in quite a few federal agencies right now.
Okay, good. I would just encourage you all to continue those conversations. And I mean, since we are in a public health crisis right now, the old rules really shouldn't apply anymore.
Yes, and obviously some of those, I would like to be able to speak, more educated, I guess, on the subject about HIPAA. Unfortunately, there's a lot of things we can't say, which is a problem sometimes. But, with the HIPAA laws. So, like I said, I do know that there's a lot of public buildings and a lot of federal agencies that we have come in contact with the issue of the virus and the person that has contracted it and their HIPAA, certainly their privacy due to HIPAA. So we are looking at that and having multiple conversations about it, and we'll continue.
Okay, good.
An update related to public health. I was on a call with our data partners at the IGT lab this morning, and if this is of interest to anyone, they have a new model that just came through that can provide estimates of how many people will need to be hospitalized in a community, and maps that explore hospital capacity. So if you're interested in seeing something like that for your community, please let me know and I'll have our team run that for you. Also, we had a question about sharing the regional support guide. And Joe, I think you asked that earlier. Yes, please feel free to share the regional support guide with anyone that you feel would be interested in it, your business community, any of your audiences, really. If it's helpful, we want it to be shared.
Absolutely. It looks like Amy K from TDOT as well has raised her Zoom hand.
Yes, I have. Can you guys hear me?
Yes.
So I was just going to speak a little bit to Rhett, what you just said. There is a website as well that Dan had shared with all of us, not to scare anyone, but it's covid19.healthdata.org, I believe, and it shows a lot of that same public health information like hospital beds, ventilators needed, ICU beds needed, and that, I mean, it's comforting to see. Like, it also shows the date that I guess we're going to hit our peak, and I think right now that's around April 18th for Tennessee. But the comforting thing is it looks like Tennessee will not have any shortages, which that's what their estimates are. But again, just information.
Thank you, Amy.
Mm-hmm.
So I have a question for, I guess, Kelly. Maybe Justin has intel. I'm interested in testing and where we are with testing, and diligently watch the press conferences in the evenings and hear the call for our state labs and the health departments to use the Abbot 15-minute testing. And I have a personal experience. My daughter-in-law had been ill for several days, and finally they decided to test her. And 7 days we waited for the results if she was COVID positive or negative. Turns out she was negative, but we waited 7 days, and she has a 19-month-old baby. So you can just imagine the stress families are going through. And I'm just wondering, what's the plan around testing and thinking about our rural communities, many of which do not have hospitals or labs? I mean, what's the plan? Do we have a plan? Do we have a good plan? Where do you think we're going on testing? I think that's going to be critical before we can open our economy and know who can go back to work when and in what specific regions. And I think about food workers. Certainly that's our business, and so food workers are top of my mind. Even like grocery stores. My good friend works in a grocery store and has been going to work every day, and you just, interacting with people. So just all of that. Where do you think the plan, where are we going on testing?
So Connie, that's a great question, and we've heard that from several people in the community. Certainly, I'm trying to stay in contact with all the mayors of the counties that I represent in the region. We are staying in contact daily with TEMA. TEMA and the state certainly are the ones that are actually organizing and taking all of the orders and requests from the communities for supplies, for protective gear. All of that is actually running through the state, through TEMA. The Abbot tests, which are the quick tests, I know there has been several requests for those. Our office has been working, Dr. Summer on our staff has been working with the FDA and with TEMA on that piece, trying to get tests. Right now I think they're making a lot of those tests. So I think getting those made and then dispersed out to the various states and counties is something that they're currently working on. But I will say that is a concern because, like you said, a lot of our smaller counties or outlying counties have a very small health department that sometimes is not always that active, and there are no hospitals. And the ones that do have rural hospitals, we're finding that those hospitals are closing in a lot of these rural counties, so that leaves them even more vulnerable. So the idea is, I think the plan certainly has been to try to get some of these quick tests out to the rural counties so that they can do testing, because what we don't want to happen is we don't want to see a community spread or outbreak in a rural county where there's not a lot of resources. So I do know that there are ongoing discussions. Again, those are very fluid as well. All states are competing for testing. They're competing for the protective gear. But I do know that TEMA is doing a great job. They are taking requests from the hospital associations as well as the health departments when there are supplies needed and tests are requested. Also from medical providers and doctors' offices. So I know that they are taking those requests, they are submitting them. Then there is a tracking number that is then issued to the organization that has requested the assistance, and those are being filled continuously. So I think this is kind of an ongoing plan. I think it's going to change continuously. But obviously the hot spots, the spots in our state which have had the most need will probably get some of those supplies sooner than some of the other areas. But again, it's TEMA's doing a great job. The state's handling all of that, and I think it's going to change. There'll be updates, and I think it'll improve daily. Justin, I don't know if.
All right, you nailed that one. I've got nothing else to add to that.
I hope that was helpful, Connie.
It certainly was helpful, but still a little discouraging, you know, when we think about our rural health situation, and North Georgia, Northeast Alabama, all in a similar situation. And so again, I think Thrive and the Thrive mission is perfectly positioned to pull together resources using the resources of UTC and the lab there, pulling together both around broadband, and we talked about that, how critical that is. I see that Thrive could play a role in pulling together a snapshot of where are we with broadband pre-COVID-19, and post-COVID-19. Maybe a year from now, we look back and say, did we make a difference or not? There's lots of conversations, lots of things happening. And so we all know that, you know, at the federal level, things move really slowly. And at the state level, you know, it takes a little bit of fire to get things going. So I think Thrive is perfectly positioned to work on the broadband issue, but maybe also we take on this issue of rural health, and if nothing else, identifying which communities have hospitals, which do not, which are able to do have the resources to do testing, which are asking for help. I mean, I think just having that picture, using the lab resources are just another way that Thrive can impact our rural communities and this region, and being a collaborative resource, convening the decision makers and the people that need help and those that have decision-making authority and need information. So I just think that Thrive is in the right place. I'm grateful that we have an organization like Thrive at this time and going forward. So do we have any other questions? Anybody else? We can probably talk all day, but we probably should not. So any other questions from any of our communities? Anybody else have a comment or question?
Yes, just real briefly. I was starting to type it, but I didn't think I was going to be fast enough. Dan had mentioned that, you know, some of the opportunities for TDOT were you know, the less traffic on the roads, and it's just an opportunity for them to do some creative problem solving in ways that are not normally available. And I think, you know, all of us can probably list different aspects of our lives where this sort of hard reset has been a blessing in some way or another, and that we're able to adapt in a way that we couldn't have foreseen. Are you all seeing any other opportunities in other facets of life where we're able to take this downturn or this pause and to find some other solutions, look at some other problems from a different perspective, because we've got maybe just a strange opportunity that we would not have foreseen, even a month ago?
John, can you kind of elaborate on what types of activities you're speaking of?
I was just more posing the question because if you had, I guess I'm just going to say this from a personal, just kind of detaching from the Thrive partnership, but on a personal level, when I first heard about this virus in China, I never thought that it would bring my family closer together.
Mm-hmm. And
I think that sorry, I've got two dogs and they're very, very opinionated about this as well. But from a community standpoint, how can we you know, despite the tragedy and despite the things that are going on, how can we rise above, look ahead, and try to figure out other problems where the uniqueness of a lack of traffic, the uniqueness of maybe you know, other things that this situation is presenting. How can we maybe tackle some problems that we hadn't even tried to tackle yet?
Yeah, I think that's what I've been spending kind of a lot of time thinking about is I think the world, you know, pre-February 15th to whenever we're back out and social distancing has become a buzzword in the past, is going to look very different. And I think you look at how organizations have been forced to adapt to this. I think it's going to lend a lot more credence to the ability of being able to adapt. Maybe those meetings that, you know, took you 45 minutes to Ooltewah can now be a Zoom call, and everybody still gets FaceTime, but we're not on the road 45 minutes traveling. Or, you know, I think we're going to value social interaction a lot more, quite frankly, at the end of this as well. I think it shows, you know, how resilient and how nimble our communities are in a lot of ways. And I think there are opportunities to build on those. I think you're going to need smarter people than me to probably tell you what problems we can certainly tackle. But I think it is sort of reshaping the way we all look at public policy, how we look at community, how we look at day-to-day life, quite frankly, in ways that, you know, 2 months ago, we would have said, no, we can't do that. You know, no is no longer a thing, right? For a little while, because we've been forced to do things that we've said we wouldn't be able or couldn't do that we now had to. So I think that'll be an interesting evolution coming out of this is what are some of those things, and no doesn't automatically the first thing that comes out of your mouth, because we've been forced to sort of be creative and really sort of think through how to solve problems that we were forced to solve, you know, because of the circumstance.
And I have kind of a specific, Kelly, that might be of interest to the senator, but I think about education and how we do education, and particularly higher level education, but even high school, middle school. So my little nephew is 12, 13 years old, and of course driving his parents crazy. But the idea that he has spent so much time, fortunately they have, you know, some space and not living in an apartment complex, but the fact that he's been out stomping around in the creek back behind his house, gigging for frogs and crawdads, he has spent a whole lot more time thinking about science and biology and rainwater levels in a very creative way. And so sometimes I think about, you know, how we do education and what that looks like, and certainly parent involvement in education now is, you know, very different. And so I think some of the way we could do education in the future, and how some of that responsibility is returned back to parents and grandparents for some of that, and what that classroom looks like going forward, and you know, will we use more online resources for students? I just think that's an opportunity for us to really rethink and allow a little more flexibility on how we say somebody got a credit, you know, a school credit, that sort of thing. So that's just a kind of a personal example. We've seen a real resurgence in his interest in science because he spent more time out stomping around. So it's been interesting.
That's right. Well, I agree. I agree totally. And that's something that we talked about just yesterday too. You know, when we open back up, what will things start to look like? And I think we'll probably do a phase in to just what Justin said. What's the world of work going to look like moving forward? What's education going to look like moving forward? Obviously, going back to school, I've got a 16-year-old. You know, she's very social. She's a hugger. She's you know, all that. And I can't see our students being able to stay 6 feet apart or more, and trying to sit in the classroom together and learn. So I do think there's going to be, just like you're saying, Connie, some way we're going to have to look at education moving forward. How do we do that? How do we keep our students together in a classroom and yet social distance? I mean, that's going to be pretty difficult. But again, I have noticed just driving through neighborhoods that I have seen families, cooking out, dads playing with their children again, riding bicycles around the front yard or whatever. And like you're saying, getting out and actually getting into nature again, not sitting inside the house playing a video game, but, out actually doing other things. So I think it's a huge opportunity, like you said, to find more creative ways of dealing with education moving forward. And then also just the way that we all work moving forward. I think but again, having said that, broadband is going to be a huge part of that. So in order to even stay connected with our schools moving forward, we're going to have some type of, broadband push for better connectivity.
And I also think it's going to change the way we look at teachers. I mean, you've got a lot of people that are now trying to homeschool their kids and realize this ain't for the faint of heart. I mean, I was fortunate enough, I grew up with a first grade teacher my whole life. Obviously, my mom was one. So, I've always kind of gotten it. But I think that's another policy area I think it's going to change pretty quickly when all these legislators had to go home and homeschool their kids for 3 months or whatever it is. So I think that's another area that we may look at. And what does the classroom look like? I think to Kelly's point and your point, Connie, it's what does that in-classroom experience look like now that we've removed the classroom from the experience, right? Because we had to. So I think that'll be a very interesting conversation, and sort of we're at this weird precipice where we can really rewrite rules because we have the ability to now. Whereas, again, it goes back to, well, we can't do that because that's the way it's always been. Always been isn't available right now. So I think it's a real opportunity to kind of rethink some of these conversations, and education and broadband and transportation are all going to be at the very, very front of it.
Very good. So I think it's time for us to wrap up, and you'll see there in the chat box, Rhett has supplied some links, and we will have a post-webinar survey coming your way. We're looking for your ideas. The Thrive staff is working just as many hours, just as diligently as when they were in the office. And so we are grateful that they have the resources to do that, and each of them are willing and very dedicated to this region. And we're so grateful for the many partners that we have. We could not be here without the support, and both financial as well as expertise. We need all of that. So we're so very grateful for your all's help to us, and we're going to just keep on keeping on. Any ideas you have that you think of as the day and weeks go on, please share those with the Thrive staff. And any additions to the resource guide, they certainly want to, as Shannon said, keep that fluid and living and growing. I want just to say again, thank you, Shannon, Rhett, Kelly, Bridget, thank you for the work you've done. This is a beautiful guide, and I think it's going to be very helpful to those that pick it up and use it. So thank you so very much. Y'all have a blessed day and be well, and enjoy your weekend.